The Supreme Court will decide if states can force hospitals to let women die. New York City subway delayed again, so tell your boss you're going to be late coming into work because they have a very suspicious cause for concern and they are killing children because of this. And a Philadelphia child was sent to daycare with measles, and now there's an outbreak. Welcome to Squirrel Tribe. Thank you for being here. If it's your first time, enjoy. If you're returning because you've been here before and you've come back again, I appreciate you for coming back. I love you all immensely. I would like to just first off say, bear with me. I am having I don't know exactly what it is, if it's an inner ear sinus thing, but the dizziness today is slightly unbearable. I am wearing my C-band bracelets to help with I guess it's like a puncture point or I don't even know what to call it because my brain is not really braining, which is why I have written everything down to get through this today without hopefully messing anything up for you guys. But thank you for bearing with me while we work through this. So let's go ahead and jump in. I do have several stories that I want to share, but we will limit this video to just 5 for numerous reasons. Time, obviously, and my ears and brain doing whatever they're doing today. Now, the first one here, Citigroup plans to slash 20,000 jobs over the next 2 years after the struggling bank reported its worst fourth quarter earnings in 15 years on Friday. The CEO, Jane Fraser, who announced a sweeping overhaul last November to consolidate departments. Citi currently has 239,000 employees worldwide, but seeks to bring the New York-based bank's global headcount down to only 180,000 after its chief financial officer, Mark Mason, said after the bank reported a $1.8 billion loss for the fourth quarter. Aside from the 20,000 job cuts, the bank expects to reduce its headcount a further 40,000 jobs when it spins off and lists its Mexican consumer unit, Banamex, in an initial public offering next year. And the Wall Street firm is expecting to incur between $700 million and $1 billion in expenses tied to the impending severance payments. CFO Mason said, "Job cuts are tough on morale," adding that the reorganization efforts will be done by the end of the first quarter. So by the end of March, big things are happening. So that leaves only less than 2 months for these folks to get ready to be laid off. That's not something you're ever ready for. Be ready to get laid off. It's just such a weird phrase. Anyway, the bank, worried about clients being unable to pay off their credit cards, mortgages, or business loans, has also set aside a bigger reserve to cover losses. And CEO Fraser called the fourth quarter results very disappointing. Fraser's reorganization plan will reduce management layers from 13 to 8 as part of its biggest overhaul in decades, which, if you guys have ever watched it, it's exactly what Kevin247 on YouTube has warned about. And the cut to middle management is happening across the board for all businesses in 2024. It's not just Citi. And you can take that to the bank. Bada bing. Or I don't know how to make the ching sound. The drum thing when you make a joke and it's supposed to be funny, that thing they make with like the symbol. I don't know how to do it. My brain isn't braining anyway. But she did say the aim is to reduce bureaucracy and increase profits while boosting the company's stock, which lags behind its peers. Rivals JP Morgan Chase and Bank of America also reported fourth quarter earnings on Friday, and they all saw lower quarterly profits after being weighed down by similar FDIC assessments. However, JP Morgan posted a record annual profit of $49.6 billion, capital B, my dudes, dollars, the highest in American banking, which it attributed to an impressive 31% improvement from its bottom line in 2022, blowing past economists' expectations. And I believe Kevin when he says Chase and Jamie Dimon will take over all the banks and roll it up into one before selling it off or managing all our money for the government. I agree. It's going to be one big conglomerate, and it's going to be Chase and Jamie Dimon running the whole shebang. Now, CVS is closing dozens of Target pharmacies in its latest cost-cutting move with plans to close 300 total stores this year. The closures are set to begin in February, which is right around the corner, and should be completed by the end of April. So you have February, March, April. Within 3 months, everything should be done. The closures are part of CVS's plans to shutter roughly 900 or 10% of its stores. The pharmacy chain has already closed about 600 stores since 2022 and expects to close the remaining 300 this year. They said the closures are part of CVS's plans to reduce store and pharmacy density, which you wouldn't think would be a bad thing to have a lot. That way, plenty of people have the ability to get what they need close to home without having to drive farther. But I guess CVS does not agree with that. The closures are based on our evaluation of changes in population, consumer buying patterns, and future health needs to ensure we have the right pharmacy format in the right locations for patients. What I hear from that, let me just go ahead and be that person. What I hear from that is they think that they're not going to need as many pharmacies in better off areas. That's what I hear from that. In places where there is a higher level of healthcare, where people are less sick because they have cleaner food, cleaner water, better living conditions. Maybe they don't need the same amount of CVS pharmacy locations. And so they're closing the ones in places where they don't get as much traffic due to the fact that people may be a little healthier in those areas. And the places where people are a little less healthy, where they don't have the same food quality, water quality, air quality, and health care and things like that. Maybe those are the locations that will remain or even open up new ones in the future. Who knows? Other major pharmacy chains, including Rite Aid and Walgreens, have also been shuttering stores amid rising competition, pressure on prescription profits, and waning foot traffic. Rite Aid also faces pressure to cut costs as it faces a slew of opioid lawsuits. The company filed for bankruptcy last year. Side note, pharmacists at the three chains have staged walkouts in recent months to protest deteriorating working conditions stemming from a lack of staff and resources. And according to reports from those familiar with the closures, patient prescriptions will be transferred. Now, I want to mention something that's totally off topic here, but when it said waning foot traffic, I don't know how many people normally walk to Rite Aid or Walgreens, but I sent my husband, Kevin247 on YouTube, I sent him a thing on Instagram that I saw. It was a gas station. Oh, I can't remember the city because I didn't take a note and my brain it hurts today. So there was this gas station that had a note on the front door that said, if you did not drive here, you cannot enter, which to me is the absolute dumbest thing in the history of dumb. I mean, there's plenty of dumb things, but this is pretty stupid. Meaning if you didn't drive up to spend money at the gas pump, they don't want you coming into their store. What about people who ride bicycles from point A to point B because one, they can't afford a car, they can't afford the insurance, the gas is stupid high, or they're not going that far, and why take your car out to go 1 mile when you could bike, you could walk, you could enjoy the outdoors, but you still want to stop in and get something to drink, maybe use the restroom, get a snack or whatever else. To limit this place to cars only is extremely stupid, but that's not what we're talking about, so we're going to keep moving on. Now, here are the types of patients who will die if the Supreme Court justices say states can block doctors from providing emergency abortion care. I need you to hear that. Emergency abortion care, okay? So the Supreme Court will decide this term whether states can force doctors to turn away patients suffering serious, life-threatening medical complications, or if doctors will be allowed to provide standard medical care to those patients, i.e. abortions. The court announced last week it will hear arguments over the Emergency Medical Treatment and Active Labor Act, or EMTALA. I don't know if you're supposed to say EMTALA or spell it out. They will hear this in April. EMTALA is a more than 3-decade-old federal law that says hospitals that accept Medicare, which are most hospitals in this country, cannot turn away anyone with an emergency medical condition. They are required to provide stabilizing treatment to prevent that person from suffering serious medical complications. After Roe v. Wade was overruled in 2022, the Biden administration issued guidance clarifying that if a pregnant patient arrives at a hospital with an emergency condition that can only be stabilized with an abortion, the hospital is required to provide that care, regardless of state law. Basically, Idaho has argued to the Supreme Court that states, not doctors or the federal government, should decide emergency medical care for women, particularly in cases of abortion. The state's attorney general contends that federal laws such as EMTALA or EMTALA, Emergency Medical Treatment and Labor Act, should not override state laws on abortion. The Department of Justice sued Idaho over its GOP-controlled legislature's criminal abortion ban, arguing it violates EMTALA care requirements. The Supreme Court recently lifted a lower court injunction reinstating the ban. Critics, including the Biden administration, argue this endangers patients and violates EMTALA protections. Declarations from doctors highlight situations where abortion is crucial for preserving a patient's health or life. The broader legal debate involves multiple states, with Texas also challenging EMTALA. Critics fear that such legal battles may restrict doctors from providing essential care, leading to potential harm or even fatalities. And so here's my question, because this one's a difficult one for a lot of people, and it may not be one that can even be answered by the majority of people. If you have a woman who could potentially die from whatever is happening to her body because of the fetus that's inside her, is an abortion, which is taking the life of the fetus and saving her life, is that better? Or is it okay to let the mother die in order to save the fetus? Either way, somebody dies. One who is alive technically by like actual standards alive is the mom. The fetus, not technically a living, breathing human at that point, technically, because your birth day, the moment you are born, the time and date you are born is when you are considered a human being at that point, as opposed to a fetus in a body. So how do you as a person decide who lives and who dies? That's always been a very hard question for a lot of people, and one that it's extremely hard for a lot of people to answer, because I think it might always depend on the situation. I don't ever think it's a cut and dry this or that, in my opinion, when it comes to mother and fetus at the same time. I'm just curious if you guys want to comment in the comments, feel free. If not, it's okay, no harm, no foul. Now, each year, hundreds of New York City subway riders pull the emergency brake for no good reason. And last week, unfortunately, that kind of vandalism led to a derailment that injured dozens of people. I mentioned it when it happened, how there was a train that derailed in New York City subway, and it was because of a idiot pulling emergency brake for no reason. These pranksters pulling emergency brakes on subways pose real dangers to the passengers, some fatal, and oftentimes done as a dare initiation or for clicks, likes, views, and shares on TikTok. Bunch of morons over there doing that. Key takeaways include quotes like, "I think this is a very scary situation, and we've got to convince the kids, and it's mostly kids that are messing around that way, that this is really unfair to other riders, and it creates risk." So a quick recap on the whole thing. Vandalism involving pulling the emergency brakes on the New York City subway has been a prevalent issue, with the recent derailment on the Upper West Side exemplifying the dangers and disruptions caused by such actions. The Metropolitan Transportation Authority, MTA, reports 1,748 incidents of pranksters pulling emergency brakes last year, leading to over 7,365 system delays, with only 30 of these incidents being genuine emergencies. Think about how often that makes people late for work, late for school, or if they happen to be in a own medical emergency of their own and they're trying to get to a doctor's office, how that could delay that, how it messes with the jobs of the people who work in the subway system itself also, and how it can cost taxpayers tons of money because of these stops and starts and failures and everything else. They have to fix everything. It's a huge deal. And a lot of times pranksters or people who are trying to get clicks, views, likes, TikTok, they don't think of it that way. They're just thinking about how they want to go viral. They're not thinking about that what they're doing is causing the damage to the people around them. So let me see, where was I? I'm sorry, I lost myself. Here we go. Professor Kurabayashi of NYU Tandon School of Engineering suggests eliminating direct passenger access to the emergency brake system and replacing it with a more advanced alert system to prevent further pranks and enhance safety on the outdated subway system. Now, hold on. I've got green tea with spearmint and lemon in it, hoping that maybe that'll help whatever's happening up in here. Sorry. Even worse and more shocking and scary, unfortunately, a 14-year-old boy was killed in an apparent subway surfing incident in Brooklyn. This is the full story. ABC Channel 7 Eyewitness News posted that an investigation is underway into the death of a 14-year-old boy who may have been killed while subway surfing in Brooklyn on Friday. Police say they responded to the Avenue North F train station in Midwood around 2:20 p.m. They found a teenage victim dead on the southbound side of the station. Authorities say it appears that the teen was subway surfing at the time of his death. The investigation is ongoing. And I'm not going to say that, this 14-year-old maybe plays the actual game Subway Surfer on his phone and thinks that, if he can do it in a game, he can do it in real life. Maybe he decided to try it out. Or maybe this 14-year-old didn't have money and couldn't ride the trains. Well, I don't know how he would have got down there if he didn't hop the turnstile. But either way, it's a terrible accident, whether this kid was, trying to subway surf or not. The fact of the matter is he lost his life, and it's horrific and heartbreaking for his parents. So a Philadelphia child, this one gets me. And this one, you guys are going to, I think, be very opinionated on this one. You'll see why. Okay. A Philadelphia child was sent to daycare with measles, and now there's an outbreak. And so here's the full story. Credit Motherly, Yahoo Life, Ariel Chinkel. This is from January 12th. Health officials in Philadelphia have confirmed a measles outbreak in the city, and it all stems from a child who contracted the virus after being out of the country, continued going to daycare. So far, there have been 8 reported cases, all but one from Philadelphia, with officials urging residents who are not vaccinated to receive one ASAP. According to the Philadelphia Inquirer, the outbreak began when an infant was hospitalized with the virus at the Children's Hospital of Philadelphia in mid-December. The infant has been in the country where measles is regularly occurring, though it's not clear which country they were in. Find that suspicious immediately. The virus then spread to 2 other unvaccinated children in the hospital, an infant too young to have been vaccinated and an eligible child whose parents had refused to vaccinate, according to the outlet. The older child's parents also refused medication that can prevent infection following exposure. Now, the outlet reports that an infected child was sent to an area daycare despite quarantine instructions, causing an outbreak of 4 other infections. So far, it seems that the cases are contained to the Children's Hospital and the daycare center, but health officials are urging residents who are not vaccinated to get the MMR vaccine, which protects against measles, mumps, and rubella, as well as remain isolated for 21 days if they are exposed. None of the infected individuals had prior immunity to measles, which means they'd either never been vaccinated or had a previous infection, making vaccination and adhering to quarantine guidelines if exposed particularly important. Health officials note that while 93% of the city's children are vaccinated, measles is a dangerous virus to those who are not. I would like to point out that it's interesting that 93% are vaccinated, but a large majority of unvaccinated just happen to be in that same area as the child who happened to have measles. I'm reading this to you because I think it's important that we talk about it. It doesn't mean that I believe everything it says, and it does not mean that I agree with everything that they're going to say in this part. But I wanted to read it to you as it was written so that you understand exactly what is being told to the people of Philadelphia and everywhere else in regards to measles, and how I believe personally you're going to see this more and more. Measles outbreak here, measles outbreak there. Make sure you're getting your vaccine. Make sure you get whatever. And the next thing you know, they're going to be like, oh, well, we can combine. Next time you go in for a measles vaccine, we can just give you all these other ones at the same time. So I just want to put that out there for any of you who are wondering where my thoughts are on this. Still want to bring it to you though, okay? According to the U.S. Centers for Disease Control and Prevention, good old 3-letter CDC, measles is a highly contagious virus that spreads through the air or on surfaces when an infected person sneezes, coughs, or breathes. Basically how everything is transmitted, just except for, like STDs, okay? It can survive in the air for 2 hours after an infected person leaves an area. The World Health Organization, another fun 3-letter organization, WHO, notes that symptoms include a high fever, cough, runny nose, and full body rash. It can impact anyone, but is especially dangerous for children under 5, pregnant people, and those with weakened immune systems. NBC News reports that roughly 1 in 5 unvaccinated people with measles ends up hospitalized, and the virus is fatal to 1 to 3 out of every 1,000 children with measles due to severe complications such as pneumonia or swelling of the brain. High vaccine rates helped eliminate measles outbreaks in the U.S. up until the year 2000, but there have since been occasional outbreaks originating from other countries. Dr. Paul Offit, director of the Vaccine Education Center at Children's Hospitals of Philadelphia, told NBC News that the recent outbreaks are likely a result of declining vaccination rates. I wonder why. Measles is the most contagious of the vaccine-preventable diseases, so when you lower immunization rates, that's the first disease to come back, he said. It's unclear if any of the infected individuals in Philadelphia have experienced severe illness, but here's hoping that the outbreak will be a fresh reminder that staying vaccinated against communicable diseases illnesses remains the #1 way to stay safe and to protect others. Again, their words, not mine. Everybody, it's up to you what you want to do with your body and your children and everything else, whether you believe in any vaccines or not, that is on you. It is a very, very divisive topic amongst a lot of people. I do know that schools, public schools in many states require certain vaccines in order to go to public schools, which are also why there are a lot of people who prefer to homeschool their children so they are not having to inject things into their bodies. I will say that before I knew any better or before I learned anything, my child got certain vaccines as a child. I got all mine when I was little, and I know this, and my child got some, but now that she is older and I know what can happen with certain things, and I know what can happen if these vaccines have not been around long enough to actually have a good track record with them, if you will, like the latest ones that have come out. There are things I will not do to my child anymore because I now know better versus not knowing better before. And that's me as a parent, and you can agree with me or not agree with me. I don't care either way. It's my child, and it's up to me and her father and her on what is going to be done, not anybody else. So there's that. The government can kiss my whole entire ass on that one. But this is something that I think needs to be talked about. The fact that now there are measles, so they say, although they can't say where the child got the measles, what country they were in, but they happen to come back over here. And then if you know that this child has measles, why are you putting him, a newborn or a baby, in with other children who are too young to be vaccinated against them? So I have a lot of questions about the whole thing to begin with. I do know that, and again, this is not me being a conspiracy theorist or anything like that. It's me being a realist and somebody who has seen what's been going on in our country and in our world. I do know that news outlets and governments and certain figures will lie. We'll just go ahead and put it out there. Lie about things that are going on in order to get people on board with what they want them to be on board with. They will scare them into doing certain things. They will lie to them to get them to do certain things. So just putting it out there. I don't live in Philly. I have not seen any of this up close, myself, my eyes on it. I cannot say for a fact that this is something that is a huge deal and needs to be, scary or you're worried about or whatever else. It's just something that they put out, and I thought you might want to know it because, especially if you live in the Philadelphia area or you have seen something like this happening in your area and thought to yourself, why is there a kid with measles at my kid's school or whatever else? Maybe it is on the rise because of lower vaccination rates with, parents today going, I don't trust it based off what's happened in the last couple of years, right? But it is something that we need to talk about always. I'm going to bring you all the news, whether good, bad, ugly, and whether it's something we agree with or don't agree with. I still think it's important that we have these topics and we talk about these topics because conversation is what makes things better. And I don't even know how to phrase that. My inner ear is killing me right now, and I don't even know how to phrase that. But I feel like without conversation, none of us would learn anything. None of us would be able to form opinions on anything. None of us would learn anything. So that's why we're having these conversations. So there's that. I appreciate you very much, SquirrelTribe, for being here and muscling through this with me. I appreciate you immensely. I know I'm not nearly as bam in your face as normal, but it's because everything hurts a little bit and all up in here. Like my right ear has been way more full feeling, like stuffy feeling, and it made me a little bit dizzy earlier, and my neck's been bothering me and down into my back a little bit for the last couple of days, but now it's in my ear. So I don't know maybe it's my pillow. Maybe I just need a new pillow, but either way, I still want to bring you guys this information because it's very important. So I love you all immensely. I'm going to go just sit here quietly in a corner and hope this all goes away, and I will see you guys again later. Love you. Bye.